This is a Founding Media podcast.
Hey guys, welcome to Apple a Day Doc Talk, and I'm your host, Dr. Ramdeen. We have here today Eric Finger. He's a physical therapist, and he has started a company. He's an entrepreneur. It's called Move Empower Concierge PT. And we're going to be talking about upper cross syndrome today. How are you doing, Eric?
Doing well. Thanks for having me on today. Appreciate it.
Thank you for coming. I just wanted to tell the audience here a little bit about you. Eric's actually a Midwesterner, began his education at the University of Kansas. He was a member of the varsity swim team and earned a Bachelor of Science in Exercise Science. He then completed his graduate training at Texas Tech University Health Sciences Center in 2002. And after that, after he graduated, he went to pursue a pretty significant postgraduate continuing education regimen. He became an APTA, board-certified orthopedic specialist, and a fellow of the American Academy of Orthopedic Manual Physical Therapy. This is really cool because it's a distinction that less than 10% of physical therapists in the entire United States have attained. So he's the perfect guest to talk about some of these postural issues that we want you to be aware of. We want you to be able to recognize. We want you to be able to avoid certain things because, as you know, guys, I'm an internal medicine doc, and my first and foremost goal for you is safety. I want you guys to stay safe, and that'll always be the theme of the way that I'm going to approach education here. So, Eric, let's start right at the top and just talk about what it is. What is upper cross syndrome?
Yeah. Upper cross syndrome is a situation where folks adopt a dysfunctional posture. It's simply kind of an imbalance between the muscles in the front of the body, the chest or in the neck, and the muscles in the back, the mid-back, and of the neck. So usually these guys in a healthy spine are in nice and in symmetry, and what you get is an asymmetry going on, and one side takes over and problems start.
Right. You get that forward-looking head. The shoulders are kind of rounded towards the anterior of the front. And because of this postural abnormality you mentioned, what are some of the typical the symptoms that you see with upper cross syndrome? Right.
So as you mentioned, as that head starts to pooch forward, what we notice on the back is there's shortening in those muscles, and those muscles connect to the bottom of the head. And that's typically where you're going to find a lot of folks suffering with headaches. And these headaches kind of start at the back of the head and can come all the way over into the front. Jaw pain is can happen, is very common, and with those headaches. And then also most obviously would be the just lower neck pain and kind of spasming or what we call trigger points, burning pain in the mid-back muscles. So it's not fun. And the percentage of people who I see with this is quite high, and particularly, you see it a lot with folks who are sitting the majority of the day.
Yeah, I actually work out with Eric. We go to the same gym quite often, and you actually see this quite a bit. It's very, very common. And one of the main points I wanted to get across today is this is a very common cause of neck pain. Yeah.
And I think you're exactly right. You see it at the gym, and typically at the gym we see fit people.
Right.
So I think I need to take that back. It's not just sedentary folks we see this. We see this with our athletes as well. Anyone who's like swimmers, for instance, anyone who's doing a lot of who's the exercise is really dominated in the front, power lifters, and
like bench pressing, things like that, where you're pushing out in front of yourself, right?
So it's not just something for the sedentary folks. You see this in folks who are fairly fit as well.
Right, and you mentioned jaw pain, headaches is one of the common symptoms of having upper cross syndrome problems, and you can even have problems with biceps tendonitis, the tendon of the biceps, just because of the way that your shoulders are rotated.
Definitely, yeah. Right. So with that postural malalignment, we're going to see the shoulder, the shoulder where it's sitting is not going to be in the right position. It can start putting pressure on some of the sensitive tissues where it sits, and can, like you said, kind of light up a lot of the structures in there. As you mentioned, the biceps tendon,
right?
Parts of the rotator cuff. Rotator cuff are kind of the four muscles that help kind of keep the shoulder where it needs to sit. Bursitis, all those kind of keywords we think of when we think of shoulder pain.
Right. So like you said, rotator cuff impingement is another problem where if you are ever diagnosed with that, it's really important to look at your posture and see if there's something correctable. The actual root cause is probably this.
I mean, in the majority of the folks who I'm seeing are going to have a postural component for sure with a shoulder impingement. It's very likely.
Right. So just wanted to sum up there. If you have this, it's, not just a postural aesthetic type thing. You can get headaches, you can get biceps tendonitis, rotator cuff impingement. If you're ever diagnosed with these or think you might have them, then we just want you to be aware that this is a thing that you can work on.
Most definitely. Yeah.
And how do you work on this? How long does it take to try to get someone to start to build the right muscles in the right places and straighten up?
That's a good question. So a lot of it's dependent on, part of it is getting in and I think number one, getting checked out, either going in and seeing your physician. My bias, of course, is going to be seeing a physical therapist because that's essentially what we do. We're kind of musculoskeletal specialists and such. But the thing is it's a two-part thing. It's getting in, having an assessment done, getting on an exercise program, but also there's some behavior changes too, making sure, folks who are sitting all day, that their desk is set up appropriately, kind of adjusting what your work environment to you instead of you adjusting to your work environment. I think that's quite huge because a lot of these things can be alleviated by even simply making sure your monitor's high enough, making sure your chair is appropriate for you and such. So if you can start some exercises, make some changes, you'll see some relief pretty darn quick.
Excellent. And who are typically the types of patients that you get that suffer from this syndrome? Who's likely to get it?
Yeah. I see a lot of folks, being in Austin, Texas, in the tech central, I see a ton of folks who are the tech folk who are sitting at a desk, maybe sitting in a laptop, creatives, anyone whose activities are biased to in front of their body, because that's what gets us in trouble. And if you're sitting, I just saw a stat the other day. The average American's now sitting 7.7 hours per day. And I'm like, that's quite a bit. So we've got to, if you have a job where you are sitting a lot, you've got to make sure that you're adding fitness and the appropriate exercises to kind of combat the rigors of, extended periods of sitting.
Absolutely. And what type of activities do you find that, when your patients come to you, is there anything besides, like typing on a keyboard, looking at a computer screen, basically hunched over like that? Any other activities that you find promote this or set them up for it?
Sure.
Yeah.
So let's go back to what we were talking about, the folks at the gym and such. So maybe our folks who are working out or athletes who tend to dominate one side, training one side of the body and not the other. We talked at the beginning that this issue is kind of an asymmetry issue, right? And we've got to, and that comes to maybe training one side more than the other. For instance, someone doing a chest press, maybe several times a week and not counterbalancing that with training the mid-back and postural muscles. Those are folks who I see who maybe aren't getting enough balance in their exercise regimen.
Absolutely. So, and that's really common. That's a pretty, common thing to see, especially amongst people who are just starting out in the gym.
Sure.
They're doing a lot of movements that they're pushing out in front of them, whether it be cables or push-ups or chest presses or, there's more of that than there is rear delt exercises or, back flies and things like that.
Right. Training the pretty muscles too much instead of hitting the stabilizers. So, no, you're exactly right. So adding that balance is so key, and it'll set you up. Number one, it's going to set you up not only feeling better, but just your performance is going to be better too. The body is only going to perform when it's simply in balance. So posture isn't just it's not just aesthetics, it's actually performance as well.
And when a lot of the fitness crowd now, the patients that you take care of, when they go to the gym and they want to train hard and go for that aesthetic look that you're talking about, the nice anterior shoulders and the chest, and What do you tell them about any particular exercises that they should avoid in the gym, or any particular movements that they should stay away from? Or
Yeah, the folks who are suffering with upper cross syndrome typically are going to have that pain in the front of the shoulder, and particularly sometimes with exercises that are overhead or out in front of the body. So if that's the case, that's kind of a telltale sign to back off there and work on exercises more on the that are placing you that train the back muscles. But also, it's probably a good time to maybe seek advice from a healthcare professional too, to kind of make sure that you're not going to aggravate. Because if you're continually kind of activating or aggravating the tissues in front, it can set you back.
Right. And can you talk a little bit about why you'd want to avoid like straight up overhead exercises, like maybe shoulder presses, for example, with dumbbells? Why that would be problematic?
Well, the dumbbell, that overhead press that you speak of, to someone who with this upper cross syndrome, who's having sensitivity to overhead movements or movements out in front of the body, this can kind of close down the breathing space. We'll say the room in the shoulder, if you will. Yeah. So if you've got poor positioning of the joint, you got to remember that you've got tissues that are in between those two bones in there, and that plays into that impingement. And that overhead press can really close down and start pinching on some of those sensitive tissues and such.
Right. And there's, when you have this abnormal anatomy, you do have decreased shoulder rotation. So you're not really externally rotating as you should in order to free up that space you're talking about to do that.
Sure. Your mechanics
until you have done some therapy.
Exactly. You're right. Your mechanics are a little off. So the tissues are going to be strained or asked to do more than they need to, and then you do that enough, and you poke the bear enough, it'll start talking to you.
You get that rotator cuff impingement.
Exactly.
Thoracic outlet syndrome.
Sure.
Problem that you can have with this. Yeah. And if, let's say, someone did something as simple as look in the mirror or saw a picture and they saw their, head pushed forward, shoulders, kind of shrug shoulders forward, and they thought they might have this, where do they go? Who do they reach out to? Who do they consult with? What do you recommend?
Sure. I think that if you're seeing that in the mirror, someone, a lot of folks always tell me, oh, so-and-so, my husband or my wife, your partner, whoever, is telling you, gosh, your head's really back forward, or you're really rounded. Those folks, I'd say, if you're having shoulder pain, if you're having, someone's brought this to your awareness and you're having shoulder pain, I think it's a good idea to reach out to your family doctor to start with, and then also even consult with a physical therapist. Again, I mean, that's my bias, just because that's exactly what we look at all darn day.
That's a really good point, Eric. We in the internal medicine family practitioners, we're going to diagnose it, right? We're going to recognize the abnormal posture and the abnormal anatomy, but there's no way we can continually strengthen those muscles, put them through a rigorous regimen to slowly correct that.
Right.
The physical therapist is key.
Yeah. So, I think starting either of those directions is a good place to do it, and even just from a physical therapist, from a consultation point of view, that's kind of where I start, is kind of find out what's going on. And find out if, as a physical therapist, are we the right person for you at that time? And if not, directing you to who that would be.
Right. And just want to say too, I work with Eric, and we take care of mutual patients, and he's actually a mobile physical therapist, which is really cool, because he'll go to your house, he'll go to your work, he'll go wherever you want, and limits your travel, just makes your barrier to care a little bit lower, right? You're less likely to cancel an appointment because you don't want to go drive somewhere and spend a couple hours of your day doing that. But just want to say again too, Eric is an entrepreneur. He has started a company called Move Empower Concierge PT, and I just want to thank you again. Thank you so much for talking about this, such an important topic.
It is. It
needs more awareness.
Yeah, my pleasure.
Rather than just yelling at someone to stand up straight, right? And pull your shoulders.
Exactly. Pull your shoulders.
There's much more work that goes into it. But I'd like to thank Founding Media for hosting us, and thanks so much for tuning in. We'll see you next time.